Okay, this is the Monterey County EMS Emergency Medical Care Committee for Wednesday, September 11th. We get a roll call.
Yes, let's see who's here. Will Hiller. Sam Klemick. Jim Langborg.
Here.
Harry Robbins.
Here.
Jody Schaefer.
Here.
Paul Wood.
Here.
Spencer Harnett. Carla Spencer.
Here.
Chris Borkin.
Here.
John Anthony.
Here.
We do have a quorum. Let me check for some alternates here. Mike Esslinger. No. No. Ex officio members, Kelsey Scanlon. Teresa Rios,
Here.
Leanne McGoski.
Here.
Wonderful, thank you very much. Okay, we do have a quorum. I'd like to let others introduce themselves.
Mike DeLeo, Cal Fire EMS.
Everyone else?
Yes.
Ben Hitchcock, EMRC, yes.
Morning, Stephen Christie, Solis Fire.
Good morning, Deborah Hopgood, EMS Agency.
Blake Anderson with the EMS Agency. John Burley, EMS Agency.
Steve Brooks, EMS Agency.
Okay. Start with public comment. Any member of the public may address the committee for a period not to exceed 3 minutes on any issue not on the committee's agenda. The EMCC will listen to all communications, but may not take any action. Is there any public comment? No hands raised on Zoom. Okay, item number 3, approval of the past EMCC meeting minutes.
Move approval of the July 10th meeting minutes.
Moved by Harry. Do I have a second?
I wasn't here. I don't.
By Carla.
Okay.
You can just do the, you don't have to put on the roll call on that, do it.
If you want to just do a voice vote, that's fine. Otherwise, we usually do a roll call.
Let's do a voice vote.
Okay.
All in favor?
Aye.
All opposed?
Want to do an abstain?
And
just in case?
abstention?
Want us to abstain?
Oh, heavens, no.
Okay, so you did a yes. Okay, thanks.
And I'll abstain due to the fact I wasn't here. Okay, on to number 4, reports. EMS Director, Teresa Rios.
Thank you. A report for this meeting, the Monterey Fire Department submitted an application to be an ALS first response service provider for the city of Pacific Grove, based on the process as is prescribed in EMS policy. This morning at the CCC, former MAC, the committee recommended for the approval of their application. So it'll move to the next phase of that process. And if approved, a contract for ALS service provider will be executed and taken to the board for approval. We reported before that we were working with IT to develop a database to handle the unusual occurrence reports. The database is now up and running. Thanks, Kimberly. She led that project and is now it has now been implemented. Our stakeholders should have received an email letting them know that the new UO app was in place. I was told by Steve today that there's also a link on our mobile app to the form that where they can submit UOs. The purpose of the UO app was to try to find ways for internally to be more efficient in the way that we track, in the way that we manage the UOs. In our process of doing that, and we are learning and trying to implement more changes there to make us more efficient. We experienced a backlog of UOs and we were responding in a slower fashion. And we know that some of these UOs may need some immediate action and just timely response to the system. You know, the whole point is to be able to implement changes to corrective actions in a timely manner. So we're looking at that so that we can develop a newer operating procedure The team has been doing a really good job at clearing the backlog of UOs and bringing them down to a more manageable workload. Understanding all of the demands on their time, we want to make sure that there's a manageable workload so that we don't get behind on those. The ask that we have for our stakeholders is that the UOs our completion of our case reviews is dependent on the response that we get from our stakeholders. Oftentimes we need an IR, we need some document, we need a question answer. Sometimes we may need to interview individuals. And the quicker that we get that response from you, the quicker that we can close those UOs. So your cooperation in this area will be greatly appreciated. The 2025 policy cycle is now, the policies and protocols that are up for review for this cycle are out for public comment. They were released on September 6th.
6th.
September 6th. There's a total of 70 policies and protocols. It is a number that is bigger than our usual. We normally have about 50 or so. Steve can explain this better, but there were some of the changes that we made affected policies that were not in the cycle. So that's why the increase in the number of policies. Do you want to go a little bit into detail about that?
We're adding 2 new treatments. One is replacing dopamine with epinephrine for persistent hypotension. It's called, we use the term push dose epi. So instead of having a dopamine drip, which is time consuming to set up, it's a quick use of epinephrine 1 to 10,000, dilute it significantly, and then administer dosing over time to help manage persistent hypotension. The other is going back to the future where we're bringing in needle cricothyrotomy. Instead of using a angiocath to create the airway, we'll be using Quick Trach 1 for pediatric, Quick Trach 2 for adults. So once we added those, it needed across the spectrum changes to policies that weren't in this cycle. So that's why you have some bloat in this one.
And our goal is to improve the system, as you know, and to try to be progressive as we can be. And we really are grateful to Dr. Burley and his effort to push the system forward in this area. So thank you for your cooperation and participating in the review of the policies and providing the feedback that we need. And so they are out, and there's also a timeline that with the policies and protocols that are up for review, we released a timeline so that everybody can see where we are along the process. It is pretty much a year-long process for us to go through the whole cycle. And there comes a time at the beginning of the year where we're closing one cycle at the same time that we're opening another one. So it could get confusing, but we want to make sure that our stakeholders are informed. Our internal timeline is a lot more detailed. There's a lot of pieces that go into ensuring that the policies are up and posted as of July 1st when they go into effect. Quick update on buprenorphine. We made a report to this committee on the data for buprenorphine. We got some feedback. We met with AMR to see what are the obstacles from seeing more successful administration of buprenorphine. And we found that the base contact seemed to be one of the bigger obstacles. So under the guidance of Dr. Burley and also in conversation with the other LEMSAs and with, I just forgot their name. Dr. Hearn.
Close.
Where is he
Oh,
from?
and Hearn?
Yeah, where is he from?
Gene Hearn is Alameda, right?
Yeah, Alameda County. He's sort of kind of like leading the buprenorphine project. We made changes to the LOSAP and we submitted it. One of the changes is that it will not require base contact, and there's some exceptions which Dr. Burley can go into a little more detail on that. Would you like just summarize?
Sure, or I can mention it in the CCC report, which comes next, if you like.
Oh, that's true.
Sure.
Sorry, I'm jumping into your area.
No, it's fine.
Another thing that I want to update you on is that the EMS agency has been working, you will see some changes on our website. We have some new requirements that we have to meet to make, under Title VI. We have to make our documents on our website accessible in English and Spanish. And we also just went through the process of making them accessible to the visually impaired. It has been a heavy lift to do that. Thanks to Corina, who is always working a lot of magic in the background. She had to learn some new skills because we are not programmers per se, and she had to make that happen. So we're very grateful that that has happened. You will continue to see some changes. We met to determine which are the sections of the website that need to be in Spanish because our website is not geared for public consumption, most of the sections of our website. But so we're trying to determine which are the sections that we really need to make sure that they are in Spanish. So you'll see some changes on our website in the future. And that also, the last meeting, we reported about the need for the EMS agency to begin to diversify revenue. We continue to do our work, hoping that hopefully by in the November meeting, we might be able to bring a report to this committee on our work related to that. And I want to end my report with a positive note. We had been trying to make contact with Salinas Valley State Prison. There has been some conversation about the demand for services from the prison. And Kimberly had been tasked with scheduling a meeting. We had a meeting with them last week.
Yes.
Yes, thank you. We had a meeting with them last week, which went really, really well. And I think that is opening a great opportunity for us to begin to a consistent communication. We have invited members from the Salinas Valley State Prison to come to and begin to attend our meetings. And they have invited us to some of their meetings so that we can learn from each other and we can understand the needs that each group has and see how we can work together to meet the needs. And I'm hoping that through that work, we might be able to realize some efficiencies there in terms of the utilization of ambulance services. It is a high demand, as we have seen, and we want to, continue our effort to improve the system. So we added them to our distribution list so they know they are aware of the meetings. We invited them to all three committees, CCC, EMCC, and Ops, and having an internal discussion as to how to continue to educate them on EMS and for us to get educated on the services and the needs of the prison. So more to come. I was hoping, I don't see them online because they said that somebody might be able to attend the meeting today. So I was looking forward to be able to introduce somebody from Salinas Valley State Prison to you today, but more to come.
They may be, I mean.
There isn't.
They didn't, oh, okay.
And that concludes my report. I'm happy to answer any questions you may have.
I just have a question or actually a suggestion. You might also consider reaching out to CPF Fire. They do the EMS response in there. They have a fire chief and they take care of a portion of the transport within the prison grounds, or they have an ambulance that they use to hand off to AMR.
Okay.
So, and then I can reach out to their chief as well.
Thank you. Yes.
I think including prison complex in any discussions regarding response is a major step forward because we're once again looking at the total macro system, not just elements of the system, not just contract compliance, what have you. We're looking at the total system countywide, and that is important. That is a growing factor. It started about a year and a half ago, 2 years ago, and we need to look for means to get them in here and communicate with them.
Yeah, in our internal conversation, we entertained different things, including whether they should have representation in the committee or even as a citizen rep. They could be a rep from South County. So, something that we will continue the conversation and I didn't want to tap him in I didn't want to start join the committee on the first conversation. So
No, but it's the macro system that we need to look at.
Yeah.
Any other questions or comments? Next, Clinical Care Committee, Dr. Burley.
Sure, thank you. So as Teresa had alluded to, we had submitted some LoSAP changes for the buprenorphine program. Primarily, we were looking at a couple things. We were looking at having this be a standing order for buprenorphine as opposed to having paramedics contact the base hospital. So hopefully that would free up the ED physicians to not have to necessarily field those calls. And would also remove one of the barriers to treatment. We had also looked at including pregnant women as a patient subgroup who were able to receive buprenorphine. Previous versions of the algorithm had excluded them, but American College of Obstetrics and Gynecology has been pretty clear in their direction that pregnant women with opioid use disorder are served best by being on buprenorphine or some other agent to prevent fatal overdose. We had looked at changing the age of inclusion from 18 to 16 and older, and that's in keeping with the change in algorithms in many of the other local EMS agencies throughout the state. And it's also in keeping with some state legislation that was passed to that regard. Those were the primary things. There is also a decision to change the CAL score from 7 to 8, minor change, but that was so that the pre-hospital CAL score is consistent with the CAL score that's used in the emergency department in most of the hospitals. So those were the changes to the buprenorphine program. And again, that was submitted to the state for a change in our LoSAP, and we were waiting to hear back from them. Hopefully we should hear back shortly. We also at CCC had a report from Steve regarding the 2025 policy and protocol review cycle. I didn't see that you're talking about that again here, Steve, so I'll just kind of very briefly summarize in that the policy and protocol review cycle has been submitted for public comment, and we're asking that we receive comment back from the public by October 25th, and just really appreciate the hard work that everyone does in reviewing those policies and protocols, and providing really important feedback. And Steve had just stressed the importance of trying to get that feedback back to us before the October 25th or by the October 25th deadline, so that we can make the appropriate changes and have time to work that into the protocol. In terms of we had a motion or request from Monterey Fire Department to provide advanced life support care to with first response services to the city of Pacific Grove. That received brief discussion, and it was passed by CCC in terms of the committee recommending that the EMS agency grant that ability for them to provide ALS services to Pacific Grove. So we'll take that back internally as agency review it one last time, and then move forward if everything looks good. And we received a report from the CQI tag committee. And those were really the highlights of the CCC meeting that we just had.
Thank you. Any questions? All right, moving on to operations working groups. Teresa.
Thank you. The working group has not met. In thinking about the type of items that go to that work group, realize that, some of them actually are coming directly here. So that's why there hasn't really been a meeting. We need to step back internally, take a look at the function of the ops working group, take a look at, what may be some items that we need to bring directly to them. I know that we did this in the past. I think it was at the request of Chief Clemic that felt that maybe there was a repeat of agenda items from one committee to the next. And so we work to fine tune and not see that repetition. You'll see that because Dr. Burley just gave a report on CCC and so, yeah, so we hope to be able to effect some change in that in the future. So we'll continue our work and report to this committee.
Any questions? Okay, and Deborah with the MHOT committee.
Good morning, everybody. Just a few quick updates on different projects and trainings that the Mohawk program has been working on. We participated in the Car Week planning events, so we developed a medical plan. And thank you to all of the agencies who contributed their staffing information for Car Week that we were able to fold into that plan, which was then included in the incident action plan for the event. We also participated in the daily planning events, daily planning meetings, and monitored any impacts to the EMS system. Thankfully, we can say there were no real significant EMS impacts or events that took place during the week, so happy to report that. We've also, DEM has put together a group to look at the coastal incident response plan and do some updates to that. We've been participating in that. We went to the initial planning meeting and we'll be at another meeting later this week related to that. And providing some input related to the EMS components of the plan. We also recently participated in the public health department's point of dispensing training. So this would be if there were efforts to say get out of vaccination or medication or something like that on some sort of mass level, say in response to a pandemic or some sort of incident. So went through some training with that, and that will be ongoing training that they'll be doing on a regular basis. We've also started participating in the follow-up exercise for the local tabletop exercise that we did, gosh, several months ago now, related to active attackers through the Bay Area UASI. So they are working on putting together a regional full-scale exercise. So we're participating in those planning events, and the actual exercise is scheduled to take place in early 2025. So more to come on that as that updates and progresses. And then I will put a plug for ChemPack training, which is scheduled to take place again on October 30th and 31st. That's a Wednesday and a Thursday. We're working on that with the Public Health Department. It's a subject that I guess thankfully we don't look at too often and don't touch too often in our day-to-day work. So I would just put a plug in for anybody to attend that training. It's Public Health and us are working to bring that on an annual basis. So I think those refreshers are always good and timely. That's all I have. If anybody has any questions, happy to answer them.
Thank you, Deborah. EMS system performance metrics, Kimberly Hernandez.
Hey. Good morning. Included in your agenda packet are the reports for the radio testing and the ReadyNet drills and we're looking at June and July. So for 800 megahertz, CHOMP had a lower percentage in June. They just had a change in their base hospital coordinator. So I spoke with Susan Duke. She was aware, and then their percentage bounced up a little bit in July. At Me Memorial, the percentage for 800 megahertz was quite low in July. I spoke to Melissa Johnson at Me Memorial, and they were having some issues with when they keyed up to respond to AMR when they were doing the drill. And so they're going to double check that AMR is hearing them because there was something going on with their handset. So they're working on that. In regards to ReadyNet, everything looked pretty status quo for June and July. And again, I report all of this to the hospitals on a monthly basis as soon as I receive it from AMR, so that if there's any problems or concerns, those can be addressed as soon as possible. Any questions on the drill and radio testing? Just roll into.
Yeah, just
Okay.
roll through it.
I'm gonna roll into contract compliance. Again, this is included in your agenda packet, the contract compliance PowerPoint. I want to point out that all priorities met or exceeded 90% compliance for June and July, with the exception of priority 1 in July for yellow. That was at 89%. We did discuss that with AMR, and AMR attributes that to they had a lot of sick calls in July, and despite their best efforts, they were having a lot of trouble filling them. So again, it was at 89% for yellow for priority 1. For MPDS, the percentages for call volume that was EMD'd for June was at 75%, and calls that were aborted with the help arrived call type were 4%. So overall, 79% of all calls were EMD'd up until the point they couldn't be EMD'd anymore, which is great. It's one of the highest months we've had. And for July, it was at 77%. Any questions on contract compliance? Okay, I'm gonna roll into the next item, which is the fire ambulance provider report. That's an informational report. Sorry, let me just get this. So it's the alternate ambulance service provider report, which is the Carmel Fire Ambulance and Monterey County Regional Fire Ambulance. So in your agenda packet, I'm just gonna go over, it's January through June. So Carmel Fire Ambulance responded to 455 calls, which with an average 90th percentile time of 10 minutes and 50 seconds for an average of 76 calls per month. And for Monterey County Regional Ambulance, they responded to 552 calls with an average 90th percentile time of 16 minutes and 24 seconds for approximately 92 calls per month on average. Any questions on that report? Okay, thank you.
Thank you, Kimberly. Old business, Steve, looks like you're up for the EMCC reappointments.
Don't have much to talk about today. Again, for those who have sent in their recommendation, thank you, city managers. We'll continue to process when you get you to the clerk's office to get the oath of office done. And then we'll get you ready for the welcome packet and move you forward. So thank you guys, and hospitals also at that. So thanks.
Thanks, Steve. Ambulance RFP, Teresa?
Thank you. We have not received approval from the state on the RFP at this point. I have a tickler to follow up regularly, and the last update that I received from them is that they were almost done with their review, but that's the update that I have.
How does it fit with the timeline? Are we going behind or? where are
It
we
is
at?
getting behind, and so we have already worked on Plan B, which is, we may need an extension on the current contract, a short-term extension.
Any other questions for Teresa? Okay, EMS ordinance revision, Deborah's on hold.
Yeah.
Health data exchange, Blake Anderson.
Good morning, everyone. Attached in your packet is a report on the health data exchange implementation. The biggest update to take away from that is as of August 30th, the Natividad and Salinas Valley Hospital, pardon me, have implemented a program called EMPI, which is to help facilitate the health data exchange and patient outcomes and PCR records through patient demographics rather than providers having to get a chart number, which has been the standard practice. The goal with the EMPI is to allow access for non-transporting agencies to have patient outcome information as well. And while transporting agencies collect the chart number when they go to the hospitals. As of right now, we are reviewing the cases of where EMPI is working and in certain cases where providers may not be getting outcomes. We're reviewing that data as of now and hope to provide an update with our EMS working group here on the 17th. But does anyone have any questions on the report that was provided in your packet? Hearing none, thank you very much.
Thank you. And finals on old business, EMS policy 3030s.
Yes, so this is still on the agenda related to the dissemination of EMD information from the AMR dispatch to county communications to the fire responding agencies. And so this has been from Chief Sam Klemick, who's not here today. So if anybody would like to address the issue, otherwise
We'll just keep it on the agenda.
they'll stay on the agenda. Okay.
Okay. On to new business. Meeting locations for the 2025 calendar year.
So, we're going to be not meeting here in this room. What's happening is, the county has determined that, in the interest of building security, that, as you know, you have to come through doors that require access, that they're looking to have this side of the access limited to just those who have badge passes. So we're gonna be looking for new meeting rooms and also potentially moving our meetings around the county to help those who respond from the peninsula or South County have better access to our meetings. So it's in a little bit in flux, but we welcome your ideas as far as whether it be useful for you or for your constituency to attend the meetings if we have them at alternate locations around the county.
The thought has been to, and we entertained this thought maybe a couple of years ago, about holding the meetings in different parts of the county so that we get out also, and stay more in touch with our folks. But planning a meeting, and one in North County, one in the peninsula, and one in South County, at least for the next year. And give it a try and see what happens. For CCC and for ops, it's not a problem as far as, the quorum. It is not, they're not Brown Act committees anymore, but it would affect this committee because we do need a quorum. It does require the in-person attendance. So we do need to think about that. That's one of the reasons why we wanted to talk about it today, because this change goes into effect in January. So we wanted to float the idea of holding the meetings in different places, but we just want to make sure that there will be a quorum. That we don't want to run the risk of not having a quorum for this committee. But I think it's fair, our folks from South County are having to come here every other month. And folks from that peninsula as well. So if we just do 3 meetings next year, out of the 6, we hold 3 meetings in different parts of the county. We could start there and see how it goes.
If I can just express my humble opinion, they have done that a little bit with the fire chiefs meetings. And we found, or at least my experience has been, it's like when you go to the remote areas like Big Sur or South County, like Greenfield or something like that, the attendance is pretty low. Speaking as someone who does travel South County, for me, Salinas is great. It's, there's a freeway, just go up the freeway. It's, pretty easy access in and out. I think it's fairly central, or at least in terms of time wise, throughout the jurisdictions in the county, so that it's a little more equitable. And it also makes it easier for planning. If you have a busy calendar and that it's like, okay, I can't do this because this meeting, I've got to go to Big Sur, I've got to go to wherever, versus it's here. I know I can pretty much judge, I need to leave at this time. And so I would just assume we keep everything, and Salinas would be doesn't have to be in this room, but in this general area would be my preference.
Yeah.
I would echo that because I come in from the peninsula, obviously, but I'm concerned about people who are coming from South County, North County, whatever have you. Let's keep it in a central location as much as possible, and minimize the overhead time of travel.
And I'd echo that, coming from Greenfield as well.
Okay.
Same thing Chief said.
Thank you for the feedback.
I enjoyed the drive.
I do also agree, though, moving it from this room into one of our public rooms. This is a public Brown Act meeting. We've ran into some similar issues with other committees that I'm on, and we use this room. There's somebody pounding on the door because they want to come in, so.
There are 2 rooms, the Cayenne room, which is right before we enter here. That's a pretty large room. For me, that one is a little problematic because it gets very echoey, so it's harder for me to hear. But it accommodates our entire group. And the other one is the saffron room, which is closer to where we are, but those are, we don't need to go through secure doors for that. We normally reserve the rooms around November, December, Corina, we still do that? Is when we try to secure the rooms, but now that we are all losing access to these rooms, I think that the competition for securing those rooms is going to increase. But we'll find, we used to be able to use the Ag Commissioner's Office conference room, which is right on Abbott. And the room is much, much bigger. It's like a small auditorium, right? But I don't think that we have access to that. So we're looking at the different options, but we do appreciate, especially from, people who are coming from South County, if it is more convenient to come here. We were just thinking, at least in the past, we had difficulty keeping members from organizations in South County because of the travel time. It changed with COVID because everybody was attending the meetings remotely. And now that we're back in person, we were afraid of losing that again. So we wanted to do a good thing, but thank you for the feedback.
Okay, anything else on next year's meetings? Okay, South County response data. Kimberly Hernandez?
Okay. Okay. We play the. Okay, so Karina's just getting that pulled up. So the South County Medical Response Biannual Review, the Contract Compliance Working Group has been looking at the South County response data and for about a year and a half now. And so we thought it was time to bring the data to the EMCC. You can go ahead and go to the next slide. So the methodology for this review, medical responses were for the city of Gonzales, city of Soledad, city of Greenfield, and the city of King within the city limits were extracted from AMR's First Watch online compliance utility. We do a 6 months because if we do too short, the call volume is too low in different jurisdictions. So that's where we got the 6 months. And all medical responses are sorted and counted as compliant or late and calculated using a straight percentage calculation for each priority and overall. Response time is not a requirement at the city level. The goal of this review is to ensure that no area or community of the county is underserved. You can go to the next slide. So we are starting with Gonzales. So from January 1 through June 30th, there were a total of 251 combined priority 1, 2, and 3 responses. The pie chart on the right-hand side is going to be the overall. So overall compliant responses was 96% with 4% being late. There's also a breakdown of each priority. So you can see priority 1 was at 95% and priority 2 is 96 and priority 3 is 96 as well. When looking at the priority 1 within the city of Gonzales, if this were a zone, it would not be subject to compliance. Compliance would not be calculated until priority 1 had 100 calls, or if we were going by the 100 call rule. So considering that, AMR is doing a very good job getting to those calls within the priority 1 response time. Even though Gonzales can be a harder area to serve, as we all know that an ambulance is not stationed within the city of Gonzales. So in most cases, the ambulance is responding from Soledad. And even then it can prove difficult to get to some areas of Gonzales within the priority 1 response time. For the city of Soledad, there was a total of 1,705 combined priority 1, 2, and 3 responses. So overall, there was 94% compliant responses with 6% being late. And priority 1 was at 96% compliance or compliant responses. Priority 2 was at 94% and priority 3 was at 93%. Soledad has the highest call volume of all South County jurisdictions due to the prison being considered within the city limits. Next slide. So now we're to the city of Greenfield. Total of 605 combined priority 1, 2, and 3 responses for an overall compliant responses accounted for 94%. For priority 1, it was 91%, priority 2 was at 97%, and priority 3 was at 93%. Similar to Gonzales, Greenfield had a low number of calls in priority 1 And as we all know, the smaller the bucket, the more each late call impacts the compliance percentage. So taking that into consideration, it is clear that during this period, AMR has done an outstanding job in ensuring, sorry, I had an email come up. Let's see. An outstanding job in ensuring that South County coverage, since generally speaking, Greenfield is faced with the same challenges that Gonzales had, is because it's harder area to serve because the ambulance is not stationed there. And so generally they're responding from Soledad in best case scenario or King City, and it can prove difficult to get to some areas of Greenfield within that priority 1 response time. Next slide, please. So last we have the city of King. There was a total of 359 combined priority 1, 2, and 3 responses. Overall compliant percentage was 95%, and for priority 1, it was 91%, priority 2 was 96, and priority 3 was 95. Happy to answer any questions.
Any reason why we're not separating the prison data from the city of Soledad, just to see how they look in comparison to the other cities?
We were doing city limits. I mean, we started with the city limits, and since the prison is city limits and it can impact, so to look at like how overall Soledad was doing, considering that the Soledad unit is primarily the one responding to the prison, that's how we sorted. I mean, this is just pretty new, so that's where we started, was within the city limits.
Do we think it makes sense maybe to separate it out for the future?
We can discuss that. Yeah.
Can we do that? Can we?
I'm sure I could do it, yes.
Is the arrival time or the on time, or when you get there, is it when they hit a certain gate? It has nothing to do with patient contact,
No,
correct?
it doesn't, because it's when they get to the Sally Port, because
Yeah.
that can be held up for a
Right.
while, but I mean,
I
for the
think,
prison.
you know, and I'll just throw out there, and I'm Kimberly, I'm not trying to give you a hard time. I just how this thing up here works. So
Mhm.
let me apologize for that right now.
Okay.
But it would be interesting to, you know, to see that breakout between the prison and, you know, to see how Soledad really looks in terms of what's happening in their city
Mhm.
versus, because I think that prison, well, actually it's 2 prisons.
Mhm.
The population that's there, they might have, between their workers and the inmates, probably pretty close to what the population is in Soledad, maybe. I don't know, Soledad's about what, 27,000?
I think, I mean, I don't know, I'm
Yeah,
just
and-
pulling a
and I'm-
number, but I
I'm not
think the
sure
prisons have 10,000 around.
What the prison is, but I mean, that's like almost like a city
Mhm.
in and of itself. And then the other thing, and again, not trying to make this difficult, but it's like, you know, even though, yeah, there is a low number of, like, there was only 6 late in King City, and I think it was like 9 or something like that in Greenfield, but it would be interesting to see other aspects, like when that does happen, what's the overall system looking like that's causing that? I know you mentioned earlier in the green or the yellow zone that
Mhm.
during the month of July, I think it was, that they had sick calls out, but we're having an inordinate amount of calls happening at that time, or these calls happening at a certain time of day? And then and I know for us, this is a real issue, are we getting what I call back-to-back calls, where we start getting stack calls
Mhm.
on top of each other, and where does that priority 1 fall in there? So like if we get a laceration and we're committed to that call, but then we have a priority 1 chest pain or injury,
Mhm.
you know, how's that looking? And I'm just thinking more for, you know, Amir would, Harry said, I want to call you Henry there for a second. But how is the overall system looking, and are there adjustments that need to be made to make sure that we're getting the best response that we
Well,
absolutely
I will
can?
say on priority 1, and I think I did it for the whole county. This was a while back, and it was brought to, I believe, EMCC. I did a priority 1 drill down to find out what was going on, because I think at that time compliance for priority 1 in general was not as good. And that requires a lot of manual. So what you're talking about, what's going on in the system, I mean, you have to pull each call individually, you have to look at what's going on in the system, you look after what other calls, and it takes a lot of time. So I had done all priority one calls for the whole system by month and found that it actually would, like, the things that were happening is, yeah, like there's a late call because there were 2 calls happening at once. It wasn't that it was anything that they could maybe necessarily do a lot differently. It's just like the nature of a 911 system. Not saying we can't do it, but I'm just saying,
But if we find it, just hypothetically speaking, that we're having a lot of these back-to-back calls or multiple calls happening between the time period of 12 PM and 1500, then maybe it's a system adjustment where we up staffing levels during those times to maybe meet those needs or something like that. And I'm just armchair quarterbacking this, and I'm not trying to, I'm just kind of trying to stress the need of like
Isn't-
really looking into it.
and I understand that. And I think first we had to look at what's the percentages of these late calls. And I mean, I understand what you're saying, but if you're looking at, 68 calls and 6 of them are late, there's always going to be late calls, unfortunately. I mean, that's just the nature of what the system is. But I think we have to look at it overall, right? And see like, where is there a huge problem in one area? And I think overall it's doing pretty well, but we can look at it, but it does take a lot of time.
But what Chief Lamborg is suggesting, isn't that what AMR does in order to know where they?
Yeah, they do demand studies. Yeah, they do demand studies.
For us, we needed to start somewhere.
Yeah.
And in the curiosity as to how response times were doing in the cities, it was one of the questions were discussed here. So we start there. Can we drill down a little bit more? Yeah. So we moved carefully first to run the data, analyze it, present it, fine tune it. It comes to the contract compliance working group. They sort of our test case because they ask questions that we fine tune some more by the time that we bring it here. And then questions like the ones that you are asking happen, which can allow us to go back and look at the data differently or dissect it differently. I believe there's an agenda item. The next agenda item has to do with the present impact discussion. So we will see what that discussion leads. And then we have to look at how we can run those reports, what kind of dissecting or manual manipulation we may have to do. But we're always open to looking at the data. And I love data. I like to crunch it. I like to see what it says. So for me, it's always fun.
And I'm sorry,
Go ahead.
I just have one more comment and the intent of these discussions, at least from my end, is not to make your job more arduous. I guess what I would throw back to your director is, as you prepare for the next budget year or something like that, should you be looking at a different type of software platform for, inputting this data so that you can pull these reports and they're not so difficult?
Well, we do have ESO and we have other databases available. Each will have its own limitations. And so as far as looking at for new software, that's always a possibility. We have to, some of the new reports that we are starting to do, then it takes for us to go in the system and see how do we run this. The systems that we have, ESO is a sophisticated database. Sometimes there may not be a CAN report that we just run, and we may need to work with ESO to say, this is what I'm looking for. If we start to see that they're just simply not able to produce and if the performance isn't there, then yeah, I think that consideration would be, do we need to go out to bid? For us, that is a major undertaking, just like the ambulance RFP is a major undertaking, because we have to run a formal RFP, and that could be a whole year. But it doesn't mean that we don't do it. We just need to make sure that, we line up the projects according to.
I think my question is in simplest terms is, do you have the tools that you need to do your job the right way so that it's not, you shouldn't have to dedicate a week of your time, 40 hours, just to figure this stuff out.
Well,
There's got to be platforms out there that have these capabilities.
There's some, can I just really quick?
Go ahead.
There's some pieces though, if you're really gonna dive deep into wanting to know where this is, like what's going on with all the priority one calls. It comes from so many different pieces and a lot of it comes in the CAD notes. And there's just not a platform that like pulls the information. You have to go through and read the CAD notes, especially if you're trying to find out where was this unit coming from? Where, did they get diverted? Did this happen? Did that happen? A lot of that is living within the CAD notes. And so it's not, I mean, we have, we can run reports on certain things, but some of that is just, it lives in there.
I've just found with databases, it's like there's always a multi-year learning curve. So like if what you say that really what that issue is then we go back and we need to discuss with the dispatch agency, hey, are we making sure that we're inputting these data points? And then they input those data points and then you go back and you can extract them.
But what she's saying is the data points are in the general text. The CAD is not created to track EMS calls.
Or
And so
if there's
that's why it takes-
something that can be added to capture that. I mean, I don't know, I'm just saying, and I know
Yeah.
because I've dealt with incident response databases before. And that, it's just, you've heard the saying, garbage in, garbage out. And sometimes there's a lot of work on the front end, but then the results are better later, so.
From my perspective, we started looking at this when there was a perception or belief that there was definitely a less aggressive response in South County. And I'm really impressed that there's not anything there, priority one or otherwise, that's late more than 10%. We've built this whole system on a 10% late, basically. And so I'm impressed because I think things have improved. And I mean, if there are ways to track it more efficiently, great, but are we really gonna rebuild the system to say, okay, now that we've achieved 10%, we're going to 5%? Is that our goal?
No, and my point isn't, it's just that, I'm just saying that if it's that difficult just to get data, then do we get the right tools?
There's difficulty. There's a point at which it gets difficult. I don't think that Kimberly has said that it's difficult to run the data. I think that what we do is that once we know there's a question, then we have to go in and see how we answer it.
Yeah.
In some cases, there's not just a canned report, but there's a way to write the report. It doesn't mean that it's extremely time consuming. That depending on how much we are drilling down, that may be where the difficulties start, as Leanne just said. Some, as far as where the ambulance was coming from at this point, that is a very granular level at which we would be looking at the data. That doesn't live, there's no box that says coming from here, going to there. That may live in the CAD notes, and that will require a manual manipulation. So the systems that exist are sophisticated, but different pieces may live in different databases, and so we have to do a combination. We're not saying that every time it requires weeks to run the data, because this doesn't require a week to run the data. We are presenting, this is maybe the third time it gets presented here.
Not this, contract compliance.
Contract compliance. So we started presenting it as contract compliance with the goal of fine tuning, so that by the time we get here, we're providing you a more polished work. Because members of this committee comprise the contract compliance working group, then they are asking the right questions with our initial report. And then from there, we fine tune. So we're not saying that it takes a week to pull the data at all. But we are saying, depending on how deep you want to go into that, then yeah, it may take some manual manipulation. The other thing is that we have to be mindful of the role of this committee, that we don't want to put ourselves in the position of the contract administrator, because then that changes the role of this committee, depending on how granular of an oversight or of a review of the data we want to do. So just those things in mind. This data does not take long to do. Kimberly she's great at looking in the data. She's definitely the right person with her background, having worked in dispatch. She really knows the system. She knows the different systems really well, and she's able to do it. We just want to move careful. We want to make sure that when we bring your data, it's accurate, and that it answers the questions. And sometimes when we start looking at it, more questions come up that we want to answer.
And if I could add, because that's really, really important. I think this is a great start. Of course, more questions come out of it.
Yeah.
Right.
And so let's just look at what we've got there. We've got priority 1, 6 calls were late. I think it's really important it deserves delving into is, well, so how late were they? Were they a minute late? Or did they just fall outside the scope of compliance? Or were they really late?
And that's the
And-
conversation we had.
Well, okay,
Yeah,
so
that
I think,
information we have.
I think that's a really good point to delve into because it goes to process.
Yep.
If it's 10 minutes late,
Yeah.
how come it was 10 minutes late? And how do we, if we can fix it, how do we fix it? So I think it's just the next level of questions.
And
I
so
think that
it's
goes to
kind of
what
like a
Chief
peeling
Langford
the
was saying
onion.
as well.
Right,
Yeah.
it's kind of like good, so we start with this, and then we'll peel the onion, but what you said, as far as like, well, how late are they?
Mhm.
That is a conversation that we had.
But the important thing to grasp here is this is an evolutionary process, as you alluded to now. I'm pleased with it, with this information, and satisfied with the content. One thing I would like to see based on what Jim commented on is that if we could break out the prison separately. And of course, in the past, we have looked at individual, late responses. I think we had 1 minute or less, 5 minutes or less, or 10 minutes, or more, or something like that.
Yes.
I mean, that is within the capability of the system to provide that data. So the information extraction is evolutionary and how we look at it. So that kind of goes along with what Jody said. So I'm pleased with this. We're looking at this in the context of underserved, no underserved areas. And I think that we're meeting that objective. So.
Any other questions or comments?
Good presentation.
Thank you.
Yeah. Thank you, Kimberly.
And
You're next.
I'll
so-
earlier, I'll tell you.
Yeah.
So the next is on the agenda is the prison impact, and that's really just open for discussion. Chief Langborg had asked for that to be put on the agenda, so I'm gonna turn it over to you so that
Yeah, I just,
you can lead the discussion.
I'd say, I brought up the prison, but I think I would say that, it's not just the prison, just like looking at data beyond, just like contractual compliance, like at the EMS system. Obviously, my perspective is gonna be from a South County Greenfield perspective. And so I have questions like where I wonder if the prison is impacting us, and I would imagine if it impacts us negatively, is it impacting the system negatively? And which is, why I like data too, because I like to see what is and what isn't. And earlier I did the public information request through the EMSA, and you gave me some stats, and we've done some crunching on the CTF in Salinas Valley, and it's significant, the number of calls that come out of there annually. And on top of that, what AMR describes as their time on task. I mean, just for instance, this is CTF 2023, they had 372 calls. Average time on task is an hour and 36 minutes. My understanding, time on task is like time of dispatch until they return to service.
Till they clear the hospital, yeah.
Right. So that's like basically the time that unit is out of service. And then if you look at Salinas Valley, 2023, 1,356 calls with an average time on task of 1 hour and 41 minutes. So just like I said, it's like, this is not me trying to nitpick. It's just, wondering, and it's like, how is that impacting our system? Because if it's impacting us, it's impacting North County, it's impacting Monterey, because it takes that. And so just seeing what is and what isn't, and then I guess going from there.
From a historical standpoint that Harry and I can speak to, we've had these discussions about the prisons for years and years and years. This is the first time I've heard that we've actually engaged them and have meetings planned. So I see this as a huge step forward.
So, and I don't know if there are other data points that you think that this community thinks we should be looking at to make sure our system is
think that's
operating
gonna
at its highest level?
Well, we looked at North County, and we ran into some system challenges there, but we worked through that. I think that the key here is vigilance. We have to be ever aware of what the data contains, and if there are perturbations within the system and performance, we have to alert to them and go from there. And I think the system is key to that right now, and we're attuned to it, I should say.
And I think that we have seen an improvement of the system when it comes to particularly the area of response times. And that is different changes that have been made that have improved it. It has allowed AMR to do their deployment plan differently, to station ambulances differently. Because I remember the days in my early days in EMS, South County, the yellow and the orange zones were usually out of compliance. Many times we're out of compliance. And we've seen an improvement where many times are now in compliance. And even now, when we look at it in a more granular level, at the city level, that it is not a requirement of the contract, that we see that the system is doing well. So yes, the prison does affect the system, but instead of seeing a negative impact, we are seeing an improvement of the response times overall. And so I realize this, I'm not surprised with some of the questions that come up or some of the comments, because a lot of what we do is in the background. So we're not always at the table discussing the minute level of detail of the data points that we track. The other thing is that we were putting together our list of different items that we track, which is actually the next item. I'm jumping into the next item, so let me wait on that.
I was just, I'm sorry.
Oh, go ahead, I'll bring mine up last.
I was just, we were sidebarring a little bit. What I would want to know from a standpoint is sort of what is the process there for one, to initiate the 911 system? Two, how many of those patients are transported to hospitals versus could they have been dealt with in the infirmary at the actual prison? You know, I think as we move forward and build the relationships with them, we can dive into that and see, you know, what is their algorithm to actually call? Just a thought.
I think that that's going to require, I think that an understanding of the system. And that's why I was happy and excited that our meeting with Salinas Valley went so well, and that they're inviting us, and they seem to be welcoming the idea of joining our meetings, because we can't make changes without understanding the system first, understanding the need. And that would be the goal for us to be able to work with them and realize some efficiencies with a different way, maybe a different flow of how that patient leaves the prison to the ambulance. Maybe there are certain individuals who don't need to go to the ER. But that's going to come with time. As again, it's like I said, it's kind of like peeling the onion, right? I don't want to. We just had this communication. It went very well. So I want to take the time. I want to take the time and learn and teach. In that process, then we can start to look at different options that we might be able to propose. But I think it is going to lead to some good things.
And Kim, in your data, does it parse out like how many were transported out of that volume?
Just response.
Just responses.
I'm also very curious because, you know, from the ER perspective, they all get transported. I think all of them get transported to Navidad. And I would say that the percentage of people who I would say don't really need to be there is probably around like 20, 30% or higher. But I also know that they don't have physicians on site most of the time. We get calls from the physicians, but they're not there at all. They don't even have access to the medical records. They call us telling us what the nurse told them. So it'll be really interesting to see what they actually have in terms of resources, because I think that it is actually quite limited, even though it appears to be more significant, because the physician, I think, is not even there or involved, I think, for a lot of the time that the patients come in.
I think you'll see the same thing with jail checks, you know,
Yeah.
the jail will send everybody they can. to Natividad to get a jail check because they're under consent decree and they don't want to get in trouble. And I assume the prison's probably feeling the same way. So they're using the system to lessen their liability, and I don't blame them because they're in trouble in some ways.
Well, and I understand that too. I think especially with jail checks and such, you know, I think it is important to make sure that the patients, the people are safe before they go into those facilities where they don't get monitored. But I do wonder if there's a way to improve the workflow inside of the prison to kind of minimize, you know, like if a patient bonks their head and they don't have any issues, you know, they don't have to come to the emergency department necessarily if they have like a certain protocol in place, you know, similar to like the EMS protocols, there could be algorithms that provide like a safe disposition for the patients that could be pretty conservative, but still exclude a lot of the transports. So it'll be interesting to actually see what they do have in terms of resources. and what they do.
Yeah, so we are looking forward to start attending. There's a committee that they wanted us to join, where they said that we would learn a lot about the system and their needs. So we're looking forward. Kimberly has been really good at following up and staying in touch and scheduling a meeting. It took some time. It took a lot of it took a long time to be able to schedule the meeting that we had last week, but it went really well. So yeah, thank you. Thank you for the feedback.
Yeah, I'm really glad to hear that the communications are open between us and the prisons. Chief Langboard, the numbers are, that's 1,700 calls between those two in 2023. That's a significant number in South County with 2 ambulances.
That's almost what our city runs.
And when I look, you know, you're in Greenfield and you've got King City farther south, and then us down at the lakes, we're another 30 minutes south of King City. There's time, you know, we're really lucky. We've got great cooperation from Fort Hunter Liggett down there. We get great responses out of, with Mercy Air 34 coming out of Paso Robles. But when I hear 2 calls come over the air, either for one for CTF, one for Salinas Valley, or an assault where 2 patients are being transported in separate ambulances, I know I've got to put that in the back of my head that my closest ambulance could be coming out of Salinas at this point for a lot of South County. And if that's in the Lockwood area, Bryson, Hesperia, that's an hour and 15 minutes to an hour and a half. So that's always been my concern with the prison is when you get those back-to-back calls like you talked about in a population that large. And now we don't have, you know, that ambulance. And I know there's no expectation. I was told, you know, years ago that the Lockwood, south of King City area, that's all wilderness response area. It's as soon as possible type of a thing, which people that live out there and us as responders understand. But we just really like to have that support because there is a fairly good population out there. And on the weekends, like Memorial Day weekend, we could have anywhere from 5,000 to 15,000 extra people just in our parks.
That's right.
Thank you very much for that work, and I'm excited to see what comes out of building a good partnership with CDCR on this, and we can possibly come to some better solutions through algorithms, through just working it out and talking it out.
It's understanding their concerns, their procedures. And you mentioned the one person in an ambulance, for example. The security concerns of the prison can impact our system, so.
Is anybody asking for a special report on the prison? I know that you said you'd like it broken out. Are you asking for that from EMS?
Well, you know, I think I would just kind of throw it back to you guys with, you know, what do you think is advantageous? I just think really my point is just like, it seems like that's something that we should be looking at. I mean, and then go from there and see, you know, find out what is and what isn't, what are our questions.
Yeah, I think that was my next step is I'd like to formally ask for break out the prison information from the city of Greenfield. And let's see where we go from there. We may open other doors, we may not.
Yeah.
Let's look at it.
And it'll help you with your discussions with them as you go to
That's right.
look for solutions.
So we'll talk internally on some of the things that have come out of this discussion and see how we move forward. Before, just so that you know, before bringing it to this committee, we'll bring the data to Contract Compliance Working Group to test the reports that we come up with and maybe once we see the data, more questions come up. But what we're looking for is fine tuning so that we can bring you a more polished report when it does come to this committee. So, thank you.
Appreciate it. EMS agency data monitoring, Teresa.
It has my name, and it's not actually a report. This is actually a discussion item that, at the request of Chief Lambert, that I think the South County, the prison impact, they're all kind of not merging into this item. He had requested this item to be added to the agenda just to see what this committee, what data points should be brought to this committee. As I mentioned earlier, the EMS agency, we track many data points. Not everything comes here. As you know, CCC deals with nothing but clinical items, ops, more operational. Then we also have CQI tag, we have STEMI, stroke and trauma committees. They also deal with their own data. And then we have contract compliance. You know, we have monthly meetings with AMR and then the contract compliance working group. But in the background, we are monitoring many different things. So, you know, Chief Lambert, this was your item, so.
Yeah, I think we've hit it already, which was just, you know, looking at what are some other items. I just want to throw it out there. I mean, I started with the prison because obviously my intuition tells me that it impacts response in my area. I don't know that it does or doesn't. That's why I want to find out what is and what isn't. But are there other things that we should be looking at? Just because when reading like the annual report and like the purpose of the EMCC, it just seems like our purpose is greater than just contract compliance.
Right, yeah.
And if there are other data points we should be looking at, and that was the big one to me, you know, and obviously South County ones, but I don't know if anybody has anything else. And I just kind of want to end it with, it's like, this isn't intended to be a thorn in your side. This is just, I'm just asking, like I would imagine anybody from any jurisdiction or anybody who sits on this committee would ask, just for the well-being of the communities that we serve. So, and that's all. And looking at it is, maybe there's something, maybe there's not. If there is, then deal with it. If there's not, great, then we know.
No, and we're not taking it that way, Chief. I mean, that's the purpose of this discussion,
Awesome.
and the role of the committee is to, we like ideas. I think there was a presentation we did earlier, I think during the, when we released that scope of work of the RFP, that one of the reasons we like to bring things to this committee is that you will tell us, you know, we hear the good, the bad, the ugly, and we need to hear that. You know, we're gonna be a better system when we are able to have those conversations, the difficult ones, you know, but I come to the table with a willingness to hear and explore.
And I wouldn't say there aren't difficult discussions.
Well,
We're just talking
there
about,
can be.
well, no, we're just talking about what we all want to do, which is do our best. And I don't think there's anyone in this room that doesn't want to do the best for the patient.
Exactly.
So
But-
Teresa, and actually this is to Dr. Burley, perhaps there's things that you guys talk about at the old MAC, whatever it's called now, that you think would be beneficial for the greater body to know, things like maybe our annual, you know, CPR on scene and, you know, save rates and things like that, that we as our representatives might want to be able to share with our constituents or something. You know, I don't want the dirty details of, you know, the stemming door to needle times, but you know, what's going on? Are we doing a good job with community CPR, et cetera?
Yeah.
Just, you know, brainstorming. But we could perhaps bring some of the items from the annual report and do a 6-month report. And then, you know, for the annual report, then you'll see the whole year data. We have some starting point. My brain's already going, so.
And that's what, and I don't have any specific, it's something that you guys may have a better idea. This would be really good to share with the whole community, not just within our medical community.
Yes, we can.
Yeah, no, I agree with that. There's a lot of things that I think we bring to the system on an annual basis that are new and different and expand care and access and I think there's a lot of really good work that gets done at these committee levels and so part of the tragedy is that most people who live and work in Monterey don't know about it, right? Don't even know we exist.
Yeah.
And so like I love the idea of getting that information out to the public whenever possible and yeah, we can kind of work on the best way to do that. But yeah, I think the more people learn about what we do here, the better.
We've been working with AMR, Kimberly's been having that, of having a higher, a stronger social media presence. So right now, we're just taking advantage of the different campaigns that happen, I don't know, high blood pressure month or something, and then we put out some short, just like a flyer or something, information, but just to make sure that people get used to knowing that emergency medical services exist and what it is. And that is one of the goals for us to find the opportunity to not only educate people on things that they can do to stop the bleed or CPR or stuff like that, but really what the system is and how it functions. We've done a better job at doing that with our board of supervisors. There was a time that, we were so silent that we were kind of like the best kept secret. And so now they know who we are. We go every year, we do presentation, and they're always very curious about what we do and ask very good questions. We get very good feedback on our annual report. So we're getting there.
Well, Doctor, you touched on something that's very near and dear to me. It's called media outreach. We have a public information officer in the county. Is that person reaching out to the media and getting the message out as to what certain elements of the county organization does? In other words, our job getting any exposure to the media and thus the public itself? It's another means of getting that information out. My answer to that, my own personal answer to that is, they're doing a very poor job, period. And have done for a long time. The county does a lot of good work in many areas, but does not get credit for it. And one way to get that credit or get that information out is to go to the media. So put it back where it belongs.
Yeah, that kind of moved actually into the announcements for the good of the order. Does anybody have any announcements for the good of the order? Hearing none, our next meeting will be November 13th at 10:30 a.m. in probably a different room than this one.
I know, it should be our last meeting
It'll be
here.
our last meeting in this
Yes.
room. Okay.
One thing, just as a point of reminder, this is November 11th and
September.
or I'm sorry,
September
September
11th.
11th, sorry, I can't get to November yet, September 11th, and this is a day that I encourage all to remember the events of 2001 that greatly impacted this nation. It's quite a tragedy, and
And I was busier than hell.
yeah, I changed my day for certain, but anyways, I encourage everybody to take a few moments to remember those who were impacted, as bystanders, innocent people who were the victims of a terrorist attack, and those who responded and gave their lives trying to save others. So quite a lot to process. I think our country's still processing it. But I'd just like to remind everybody what the anniversary of, we have today is.
Steve? Nothing further, meeting's adjourned.